1:45, and I'll call this meeting of the Board of Supervisors back to order. We are now going to be dealing with item number 7, which is to receive the 2020 Live Well San Diego 10-year impact report and presentation. And I believe Nick is going to be doing the presentation on this, but I'm not sure whether there's any other introductory comments. So,
Mr. Chairman, that would be me. Thank you.
Okay, take it away.
Thank you, Chairman Cox, members of the board. We are both proud and humbled here, the team, to share the 2020 Live Well San Diego 10-year impact report, a decade of healthy, safe, and thriving communities. 10 years ago, Live Well San Diego was approved by the Board of Supervisors. And this is a regional vision which aligns the efforts of county government, our government, cities, businesses, community partners, and individuals toward a shared purpose to help all San Diego County residents live a healthy, safe, and thriving life. On this day, we look back over the last decade of Live Well San Diego and share several significant achievements and lessons learned. We also discuss the connection between COVID-19 and Live Well San Diego. We know a part of an antidote to fighting a pandemic is having an effective population health leadership, which we are fortunate to have with Live Well San Diego. Because this vision spans the work of the county enterprise, here with me to present are my fellow Deputy Chief Administrative Officers, Holly Parter of the Public Safety Group and Sarah Agassi of the Land Use Environment Group. Now, before we each present on our results, let's hear from the voices of our community and watch 10 years of Live Well San Diego in action in this short video.
Dealing with Live Well San Diego has been just a blessing. I'm able to go to things like the Live Well Advance and speak at different forums, which is really incredible, and partner with all these Live Well partners.
We're a really small, grassrooted organization. It's the strength of partnerships and relationships that is moving this forward.
So the thing I love about Live Well San Diego is it really puts the person at the center of development.
Our vision is that we want to leave a legacy for the next generations to come.
Together, we've been very powerful. We've shown the results that you can get are amazing, and we look forward to continuing to work on these partnerships into the future.
How do we collaborate on a regular basis? How do we make that part of our DNA and the DNA of other organizations? Once you do that, true change starts happening.
As we just saw, Live Well San Diego is more than just a catchy phrase or some cool tagline. It's about real results using social change and helping San Diegans achieve their fullest potential in health and well-being. And to start off, let's look at some key accomplishments, starting with Building Better Health. Building Better Health was the first building block of Live Well San Diego that was adopted in July 2010. It focuses on improving the health of residents and supporting healthy choices. It serves as the blueprint for improving community health and quality of life over the long term. It's about achieving health equity throughout all of San Diego. You see, Building Better Health was a direct response to a startling statistic that found that throughout the nation and locally here in San Diego, 3 behaviors, poor nutrition, lack of exercise, and tobacco use were contributing to 4 chronic diseases: heart disease and stroke, cancer, type 2 diabetes, and respiratory conditions. And these 4 chronic conditions resulted in over 50% of all deaths in San Diego County. And that became known as the 3-4-50. But actually, it wasn't 3 for 50 when we started. It was 3 for 57, 57% of all deaths. Now, during the last decade, efforts in support of Live Well San Diego's vision has driven a 12% reduction in the percentage of deaths associated with preventable health threats, from 57% to 50%, one of the best in the nation. This improvement happened as a result of working steadfastly with the San Diego County partners and residents to provide opportunities to eat healthier meals, to get access to food, to be more physically active, and to reduce tobacco use. We have seen a 22% reduction in heart attacks because of collaboration of individuals and organizations working across sectors to improve our heart health. This has been a significant outcome. In fact, heart attacks are no longer the #1 cause of death and disability in our region for adults. We have innovative programs like Love Your Heart, a free blood pressure screening event serving tens of thousands annually, and Be There San Diego, a coalition of patients, providers, healthcare systems, and organizations who have established heart attack and stroke-free zones, among many other efforts. We're paving the way in health and wellness to reduce and prevent childhood obesity through policy and systems and environmental change. Between 2010 and 2018, there was a 7.7% reduction in obesity among school children, representing 4,300 fewer overweight, obese, elementary-age children. Again, one of the best in the state. As an example, the Chula Vista Elementary School District is a partner that has improved student health by addressing factors that contribute to childhood obesity, such as enhancing their school wellness policies to limit unhealthy treats, to provide more fresh vegetables, and increase physical activity, and improve social and emotional supports for the students. Their work has led to development of a nationally acclaimed Body Mass Index Toolkit, became known as the Tools for Schools Toolkit. And the Live Well Schools initiative now, which implies almost every school in this county, is helping children in all of our school districts fight childhood obesity. Now, these are just a few of the many incredible impacts in Building Better Health. But next, to share about the important accomplishments that advance living safely is Holly Potter.
Good afternoon, Chairman Cox and members of the board. The cornerstone of Live Well is really collaboration and partnership, and that importance extends to public safety. As was highlighted in the introductory video, there has been a 26% reduction in the countywide crime rate over the past 10 years, and the San Diego region continues to be one of the nation's safest. That doesn't happen by accident. Achieving and maintaining historically low crime rates is the outcome of intelligence-led policing from our Sheriff's Department, the result of partnerships that exist among local, state, and federal law enforcement agencies, in addition to community support and involvement. The county and our partners have expanded support for treatment and rehabilitative services for the criminal justice involved population, and the sheriff has expanded reentry support for people exiting our jails. The probation department is connecting supervised individuals to care, all while the county has taken on added criminal justice responsibilities from the state. Cross-sector collaboration between public safety, health and human services, and community providers is the key to success, exemplified most recently by the strategies included in the district attorney's blueprint for mental health reform. Over the past several years, criminal justice partners in San Diego County have been working to transform juvenile justice system with the goal of improving youth outcomes and public safety. One significant measure of progress is a 77% decrease in the number of youth in custody from 2010 to 2020, and the youth arrest rate continues to decline. I want to stop there and just say that again. 77% decrease in the number of youth in custody. That doesn't happen without a shift in culture. Still, we know there's more to do to support youth and community safety. We'll continue to design new approaches to diverting youth from justice involvement and supporting youth in our care in partnership with a variety of justice stakeholders and in collaboration with community partners. We will provide more resources to victims of crime and support safety and justice for all residents. As evidenced by the red flag warning that we're experiencing right now, wildland fire is persistent in San Diego County, and emergency preparedness has been an area of particular focus and public safety investment. Over the past 10 years, we've built a local firefighting capability that's second to none. The San Diego County Fire Authority, or as of yesterday, the San Diego County Fire Protection District, their fire protection and emergency medical services protect residents and visitors every day in the unincorporated area. Fire and emergency services work with animal services, law enforcement, community teams, and volunteers to improve readiness and reduce our risk to devastating wildfires. And across the region, emergency readiness efforts are designed to meet the access and functional needs of all residents, with urgent messages shared with diverse populations through trusted community partners. Emergency preparedness resources will be coordinated across the county for the safety of every resident. So now that we've discussed building better health and living safely, let's hear from Sarah Agassi, who will share how Live Well San Diego is helping residents thrive.
Thank you, Holly. As indicated, collaboration has been a key factor in Live Well San Diego's success. County team members and community stakeholders are working together to maximize our resources to help our communities thrive. In recent years, we have identified opportunities to improve how we access program data, engage with community networks, and use resources. For example, cross-departmental data is being used to produce better outcomes, such as the recent partnership between Public Works and Public Health to evaluate the data around traffic accident hotspots. Another example is the partnership between Planning and Development Services and Aging and Independent Services to provide information to seniors on opportunities to place granny flats on their properties. Our Thriving initiatives provide practical, tangible benefits within our communities. In 2016, the Board of Supervisors directed the Live Well San Diego Food System Initiative that allowed the county to take on a greater role throughout the region in the advancement of a healthy, safe, and thriving food system. Promoting food donations was determined as a main priority of the initiative, and subsequently, the Food Donation Action Plan was created. This plan paved the way for 85 charitable feeding organizations to increase food donations and reduce food insecurity, resulting in the distribution of over 75 million pounds of food to those in need over this last year. The Food System Initiative and our partners have also supported the recovery of over 27 million pounds of edible food, increasing food security and making headway on the county's sustainability goal to divert 80% of waste by 2030. Yet more needs to be done. With the pandemic, the need for food assistance among San Diegans has increased. Since mid-March, the number of food bank patrons increased from 521,000 to 770,000 people per month, and the number of individuals and families applying for monthly food benefits from CalFresh has increased by 200%. As we move into the next decade of thriving, we will continue to focus on communities from an equity, social, and environmental justice lens with programs such as SD Nights, which will help more than 8,000 at-risk youth thrive by offering 200 events next year. The implementation of special projects to reduce air pollutants in the communities more directly impacted by pollution will also help residents in places like Barrio Logan, Logan Heights, Sherman Heights, and Western National City. The Library High School program will provide more adults with high school diplomas. By using data-driven approach, we will identify service gaps within our community to improve the quality of life for our residents and visitors. Now I'll turn it back over to Nick.
Thank you, Sarah, and thank you, Holly, for your great leadership. Now, we only highlighted a few of the major accomplishments Live Well San Diego's had across our entire region. To learn more about what we've accomplished, we have a detailed 2020 Live Well San Diego 10-year impact digital report, which can be found online at livewellsdannualreport.org. In this report, you'll find that Live Well San Diego has brought forth new avenues across the region, has been shared, about data, advancing best practices, increasing research, building capacity, leveraging support, and improving evaluation. In the report, we acknowledge the significant work of Live Well San Diego and our partners who represent businesses, local governments, school districts, community and faith-based organizations, and other entities. They are the faces of our diverse region, and they are at the front lines championing the vision of Live Well San Diego. And just a few days ago, we actually acknowledged our 500th partner of Live Well San Diego with the San Diego Convention Center. Examples of work that has been spearheaded through our partnerships include the annual Live Well San Diego 5K, our kids' 1 mile fun run, our Love Your Heart and Live Well Advance. What we've demonstrated over the last decade is that when we work together, when we really work together, we can accomplish more than any one of us could do alone. And on that note, it's important to share that the annual report has a section dedicated to address the impacts of COVID-19 pandemic. Live Well San Diego's successful model of community engagement allowed for the rapid dissemination of information updates about the COVID-19 pandemic, while also ensuring the public had a venue for asking questions and getting clarification on what was turned out to be a very complex and still ever-changing emergency response. With 3.3 million people living in our county in both rural and urban centers, working in various business sectors, speaking different languages, and coming from different cultural backgrounds, it's been important to ensure a focused and robust approach to this outreach effort. To do this, Live Well San Diego's framework was activated immediately. The 4 Live Well San Diego partner sectors, cities and government, business and media, community and faith-based organizations, and lastly, schools and education, were convened initially and then quickly expanded. And they now include 10 additional sectors and 13 subsectors to help our vulnerable populations. Through this sector structure, thousands, literally thousands of stakeholders have been given focused COVID-19 information each week, including information about current statistics, testing, availability, physical and mental health, sector-specific resources, closing and reopening guidance, regulations, and more. As part of this response, new stakeholders from every sector developed a connection to the County of San Diego and to the Live Well San Diego vision. Now, turning to the decade ahead, we have the opportunity to leverage 10 years of experience and to think in new ways about important issues such as equity and disproportionality, societal structures and the effects of new technologies, criminal justice, healthcare, and the homeless population, just to name a few. As we look ahead, the vision for the future will advance our work in the following ways. Through the lens of health equity, we will not only create partnerships, but we will cultivate and strengthen engagement in our partnerships to foster stronger, longer-lasting change. In San Diego, we know that the diversity of our culture is our strength. We will maximize our outreach, education, and deployment of resources so that we can be integrative and intentional more than ever. We'll aim to improve efficiencies through through collaboration with our partners as we serve individuals and communities. We'll increase our cultural competence, our communication and information sharing with individuals, families, and communities. In this manner, we will work across sectors to address healthcare, social justice, environmental issues, and advance a moral economy. We aim to be more sophisticated in our work with the community in new and innovative ways because, well, the world has changed over the last 10 years, and we must change with it. Where we acknowledge the advances we've achieved, we are reminded of the many lessons learned, the significant challenges, and the numerous improvements still to make. As we enter the next decade, not knowing what the future may bring, we must be nimble, we must stay united, and we must be ready to pivot when ethical, community, and social landscapes tell us to shift in new directions and advancements. San Diego County is engaged, energized, and live well San Diego, from our leadership to our industry sectors to our residents. In 10 years, we've gone from attracting our first community partner to joining our social movement for wellness to now celebrating, as mentioned, 500. This has happened because we've been able to create a platform in Live Well San Diego where we can regularly and intentionally work with all of our communities in their full cultural, social, economic diversity. It's a platform that invites all to participate in. We become an authentic partner in changing the conditions for well-being. Through Live Well San Diego, we're better able to set up our community for success, providing education to make informed, positive choices in the context of protective and supportive environments, policies, and systems to advance infrastructure, technology, public policies, services, and resources. Live Well San Diego supports exactly what the county stands for, that the noblest motive is the public good. The board's ongoing interest and support of Live Well San Diego's vision in action is greatly valued by our workforce and our partners. And with the support of your board and the future board, we'll continue to partner with our communities and provide solutions to help San Diego County residents build better health, live safely, and thrive. Mr. Chairman, members of the board, thank you for allowing us to provide this update. This concludes our presentation, subject to any questions or comments.
Okay, I know we have, I believe, 5 speakers that wish to address the board on this item, but let me ask if my colleagues have any questions or comments at this point. Okay, seeing none, let's go ahead and go directly to the public speakers.
So, Mr. Chair, our first 2 speakers are Kathy Lembo and Barry Pollard. So I'm going to unmute them together because I believe they would both like to address the board at the same time.
Hi, this is Kathy Lembo with SBCS.
Hi there.
Hi.
Hi, this is Barry Pollard. I'm here as well. Kathy, would you like to start?
Okay, Barry. Supervisor Cox, wow, this is your last meeting. What we really wanted to thank you for is your support for our community over the past 25 years, and more specifically, your support of Live Well San Diego since the beginning, for its initiatives, its projects, and its activities. Look at the Bayshore Bikeway, which we all hope to see you riding on now that you'll have all that time. You've just been such a strong partner for Live Well San Diego South Regional leadership team, and also for the voices in the community, and have stood behind local leaders and providers in taking action to make change. You have also supported the promotores and the work they do in the community. Your support of youth is unparalleled. The opportunities that you have recreated for former foster care youth, for child abuse victims, for young people in the justice system has really gave them the opportunities to thrive. Your work shines through in the success these young people are having. Barry, you want to pick it up?
Sure. Thank you, Kathy. Greg, I'm honored to help present the San Diego County Champion Award to you. You have certainly been a champion in spearheading the Central team down here in Live Well San Diego and the Central team. You've over the years I've known you and enjoyed it, every bit of it. You've been a true supporter of Southeast San Diego. You were working on equity and looking at reducing disparities long before it became popular. And I want to thank you for that. In retrospect, it was exactly what this community needed. You helped push the Live Well Center through. You know, that was a big lift. And all of your team and the Live Well team did a wonderful job providing a consolidated service that will help improve service accessibility to our community. You consolidated a number of services that we currently have into one building, and I'm sure we're going to be experiencing the benefits of that consolidation. Your work with grandparents raising children, I've stood from afar, and I love that nonprofit group, and obviously you do too. You guys, they're a group that basically is stepping in for their parents, whether the parents are emotionally or physically unavailable. I'm going to miss you, Greg. I'm going to tell you, your wonderful staff, especially my daughter, Kia, and she's really not my daughter, you guys. But you are definitely going to be missed, and I'm sure the future is going to have probably the amount of excitement you want, but more relaxation. So good luck. Please stay in touch. We have an RLA graduation coming in January that we want to invite you to. It's the 23rd, but I'll circle back around and try to firm that up. So thank you, everyone, for allowing me and Kathy to give this a champion award to Greg. He certainly deserves it. And like I said, you will be sorely, sorely missed, my friend.
And Greg, I hope that you can imagine and hear the standing ovation that you're getting from all of us in the district and throughout the county. Thank you so much, sir.
Yep. Okay, I think we're checking out. Thanks, you guys. Thanks for the time
Bye.
and the opportunity to board. Take care.
Thank you.
Thank you both. So next, we're going to be hearing from Danielle Hernandez, who'd like to speak about District 2.
Good afternoon, esteemed County Board of Supervisors. My name is R. Daniel Hernandez. I have the honor and pleasure of being the community chair and as part of the community organizations that comprise Live Well East Region leadership team. I am here to present our Live Well champion for her exemplary life and service for the residents of the East Region, Dianne Jacob. First of all, Supervisor Jacob, your more than 3 decades of service in county government, including 28 years as a District 2 representative, has set a historic standard for those who follow you as elected representatives in our county. We want to thank you for your efforts and advocacy in the East Region and always being a champion for the residents of the East Region. Your continued support and advocacy for the Live Well San Diego East Region leadership team. I also want to take this opportunity to thank Nick Machon and the HHSA East Region staff who, in working with your office, have provided outstanding support for our efforts to reduce issues such as school absenteeism, increased physical activity and healthy eating, medical, dental, behavioral health, and homeless services, and also increasing resources for an aging population. Your work for the aging population has become unparalleled. It has become a cornerstone for the County of San Diego's intergenerational efforts, the Age Well San Diego initiative, and it has allowed for the development of a roadmap designed to keep older adults safe, healthy, and thriving. You have been a trailblazer in the truest sense when it comes to supporting people living with dementia and their caregivers. Through your determination and passion for this, San Diego County has become a national leader in Alzheimer's related efforts. Supervisor Jacob, you have made a significant dent in history, your progress on key issues affecting East County. Some may call you the Iron Lady, but I think you have the golden touch. From concept to completion, you get things done. You've faced and tackled many issues regarding wildfire protection in the East region, improving fire protection, and protecting vulnerable backcountry communities. At this time, you've also established grants to help residents make their homes safer and protected them from wildfires. We appreciate all the service you have given the East region and its residents. You'll always be part of our community. We present this Champion Award with many thanks for all that you have done for our residents.
Well, thank you very much. And finally, we're going to be hearing from Greg Angel, representing North County. You may need to press *6 to unmute yourself.
Hi, Supervisor Gaspar. This is Greg up in Escondido, and it is such an honor to join you and the rest of the board and everyone here today to honor you and to say thank you to all that you have done in your leadership at the Board of Supervisors. I'm here on behalf of our entire North County Live Well leadership team. Literally dozens and dozens of hardworking community-based nonprofits who you have supported, and to present you with this honor as a true Live Well champion. And Kristin, I am calling you from a construction site and a graduate lodging residential site that you made possible. What used to be a blighted motel here in Escondido, that we are in the process of converting into a place to truly live well. And this afternoon, an individual who has overcome homelessness will be moving out of this graduate lodging hotel and into a home of her own. She's one of thousands of lives that you've impacted. Your leadership and your dedication to families, to addressing food insecurity, to strengthening and creating a true safety net of addiction treatment for dually diagnosed individuals, regardless of their ability to pay. Frankly, I was given 1 to 2 minutes, and it's not nearly enough time to speak to all you've done in a matter of just a few years, Kristin. So Supervisor Gaspar, it's our honor at the North County Live Well leadership team, on behalf of that team, on behalf of the Alliance for Regional Solutions, bringing together nonprofits in our North County cities, and from all of us here at Interfaith Community Services and throughout District 3 to present you as a true champion of Live Well. Thank you for all that you've done. You have changed and saved lives, and your actions will continue to change and save lives for years to come. Thank you.
So thank you very much. And that concludes the public testimony on this item. Chairman Cox.
Okay, thank you very much. This is a report, so we don't need to take any action on it to receive the report, but let me just make a couple of comments. Number one, I want to thank Kathy Limbo and Barry Pollard for their very kind comments concerning my involvement with the Live Well San Diego. You know, I've been involved in local government now, and city council level, and then up in Sacramento as a director of local government, and then now the last 26 years on the Board of Supervisors. And I've never seen an initiative or a vision, I'm not exactly sure what we call it, but I've never seen anything like Live Well San Diego that has come up that has really been more of an umbrella for everybody to get under. I mean, the reality is, who doesn't want to live well? Who doesn't want to live longer, healthier lives? And when Nick unveiled this initiative, our vision, back in 2010, it was supposedly going to be a 10-year plan to build better health, to live safely, and to encourage people to thrive. Those 3 initial building blocks that he talked about. And I remember initially we focused on our county employees, and they started doing things that were healthier. We took vending machines out of our county buildings and encouraged people to get more involved in walking around their buildings during their breaks and lunch hour. And it just kind of evolved from there to suddenly be an initiative that encompasses the entire county organization. And when I say that, I mean literally every department in the county of San Diego has contributed to the Live Well vision. The fact that we've been able to see such dramatic results from the initial efforts focusing on those 3 bad behaviors of poor nutrition and smoking and a lack of exercise to address those 4 chronic conditions, which, as we've heard in this report, we've actually driven one of them out of the top indicators of death in our region. The dramatic results that we've seen, the 22% reduction in heart attacks, 26% reduction in the crime rate, with 77% reduction in youth custody. Those are just some of the indicators of why this has been such a tremendous program. And Nick, to you and your staff that worked so hard to put this together, I can't say enough about how appreciative I am of your leadership and your commitment to this. The fact that we have over 500 community partners now, which includes schools and churches and nonprofits and businesses. I remember one of the earlier ones we had with Northgate Gonzalez Markets, where they not only became a LiveWell partner, but they really started to take an inventory of what they were selling in their stores. And they started having cooking classes where instead of using lard, they used other products that were a lot healthier and safer. So, I mean, this has been an effort that has culminated in 10 years, but my hope is this will be the lifeblood of the county, and that'll continue on for another 10 years and maybe even beyond that. It's one of those things that it's once we've lived it, it really gets into your blood, and you just you want to see it continue forever. So just as one member of the Board of Supervisors, I want to say thank you, Nick, Helen, the entire Health and Human Services Agency, for all the great things you've done to promote Live Well San Diego and to really make it a part of the county culture, the County of San Diego. We do say that the noblest motive is the public good, and I think nothing could be more noble than to encourage people to live safe, health, and long lives. So thank you very much, Nick, and your team for a great job.
Mr. Chairman, if I could make an additional comment. Live Well San Diego, it had me at hello as soon as I was seated on this board. And Dr. Nick often reminds us that Live Well is about preventing the preventable. And Live Well San Diego is a beautiful prevention strategy for our region, and it must be strengthened for years to come. The typical government approach is waiting for people to reach an absolute point of crisis before intervening. But the Live Well San Diego approach promotes a proactive investment in human potential, and it's a really beautiful thing. So it's been incredible to be a part of this. Thank you, Greg, for your kind words today. Live Well San Diego acknowledges that the government can't solve significant social challenges as well, that we have to come together, and we have to come together with our community and this wonderful network of nonprofits that are very passionate about their purpose. So Greg brings up an opportunity that was presented between Interfaith and the County of San Diego, and now someone's going to have a roof over their head tonight. So I love hearing these stories. Keep up the good work to the county team, and it's just been a wonderful thing to be part of Live Well San Diego. Thank you.
Okay, other comments by supervisors? Supervisor Fletcher, go ahead.
Thank you, Mr. Chair. I want to commend the entire Health and Human Services team. I think 10 years of Live Well has really put us in a strong position with a commitment towards public health, a commitment towards engagement, healthy, active living. And I think as we move into the future, the next 10 years, we'll see continued progress and growth in the investment and the focus and the prioritization around issues of health, and with a concerted and intentional movement into issues of health equity. COVID has really shown us significantly the tremendous disparities. And as we move into the next decade, it's not just about seeing a countywide reduction. It's about ensuring that that reduction is equitable across multiple things. If you have certain communities that have significant reductions and others that have increase and it's a net reduction, well, that's still not the aim. The aim is to make sure every community is impacted. And so I think the work that's been done, the foundation that's been laid, has been incredible, and it's created a tremendous framework that now we can really come in and invest and focus and prioritize so that the next 10 years can be something that we can all continue to be equally proud of and equally committed to as we move forward. So great report, great work, and I am incredibly excited about where we can go over the next 10 years.
Thank you, Supervisor. Vice Chairman Desmond.
Thank you, Mr. Chair. And I just want to say thank you to all the HHSA staff as well, for all the hard work, and for Nick, bringing this forward. You've really kind of woven, Live Well into the fabric of the county. And I remember, I think, Nick, you came to the city of San Marcos. I think I was mayor at the time, and we adopted and became a partner. You sold us. So appreciate all the efforts. Congratulations, and looking forward to better results in the next decade. Thank you.
Very good. Thanks, Vice Chairman. Supervisor Jacob.
Yes, just quick comments, Mr. Chairman. I agree with all that's been said by my colleagues, so I won't repeat those. It's a great honor for me to be a champion among champions, and thank you for the recognition. And Nick, this was a great initiative, and you deserve the credit for starting this, and it's been a very, very successful. Thank you.
Thank you, Supervisor. One thing I've learned over the last many years on this Board of Supervisors is a lot of Nickisms. These are the sayings that Nick periodically throws out, and one of them is that it takes a team to make the dream. And I think that I would be remiss if I didn't acknowledge and thank Barbara Jimenez in South Region, and also Alexis Avina for the work that they've done in helping to promote Live Well San Diego and in the South Region and throughout the entire county of San Diego. They've done a tremendous job along with Nick's entire team. So thank you all very much. If there's nothing else on this item, we'll go to the next item, which is number 8. This is an administrative item. This is the third consideration and adoption of an ordinance adding and repealing provisions in the San Diego County Code regarding the sale of tobacco products in the unincorporated area of San Diego County. Let me ask if staff has any additional comments. I know we do have a number of speakers on this item, but if there's any additional staff comments, I'd like to go ahead and hear them at this time.
Before the staff begins their comments, any members of the public that have requested to speak in this item, please dial into the conference line now using the instructions that were provided to you. You will be muted until it is your turn to speak. Thank you.
Chairman Cox, there are no additional comments at this time. Thank you.
Okay. Then do we have some speakers lined up ready to go?
We do, Chairman Cox, and also note for the record that we received 25 e-comments on this item. We'll be calling speakers by the last 4 digits of their phone number. You'll hear notification that your call has been unmuted. Then you'll need to press *6 to unmute your line. Each caller will be asked to state their name for the audio record, and you'll have 3 minutes to address the board. You'll hear this sound when your time is up, so please conclude your comments at that time. And I'll remind the public speakers that they should mute their TV or live video stream before they begin speaking. Aaron, if you could please identify the first caller.
Yes, our first caller is 4592. We're having trouble hearing you on your end.
Good afternoon. This is Kathleen Lippitt. As a small business owner, public health practitioner, and researcher of youth drug use, I want to thank Sandag and the county for the decades of valuable, high-quality, relevant, and current data and trends on juvenile arrestee drug use. These youth are the equivalent of canaries in coal mines. The data on tobacco and marijuana use is alarming. It indicates a 20-year high in drug use. The epidemic of youth marijuana use continues unabated in the face of marijuana industry lobbying to grow their industry. Sandag data was created as a tool to inform drug policy decisions. Some leaders prefer it simply run silently parallel to policy making. If Sandag data were considered, there would be no efforts to remove the sensible requirement that employees be 21, or to allow tobacco licenses to be transferred to family members when they risk suspension for bad behavior. If license suspensions can sidestep consequences for violations, the risk of license suspensions becomes an impotent deterrent. The cost of weakening tobacco or marijuana license requirements will continue to be paid by more generations of youth. They will be derailed by drug use and addiction. Please consider your future policymaking decisions to ensure youth are a priority in moving forward. Thank you very much.
Thank you. Our next caller is 4400. 4400.
Hello. Good afternoon, Chairman Cox, supervisors, and staff. My name is Arkan Samo, President of the Neighborhood Market Association. First, I want to know where can I buy a copy of that beautiful tribute video for Supervisor Cox and Supervisor Jacob, because I have been watching your journey since 1995. I don't know if you remember Supervisor Cox and Supervisor Jacob, but I appeared before you for the first time in 1995. And that was the first time I ever appeared before a government body. You, along with Supervisor Bill Horn, Ron Roberts, and Supervisor Pam Slater, okay, were very gracious to me because I was so nervous. So I wanted to know, I remember your journey from the beginning, and I'm so grateful to be a part of it. On behalf of the Neighborhood Market Association, and as a member of the Chaldean community, I would like to express our sincere and deep gratitude and appreciation for your decades of public service. The San Diego County has benefited greatly from your leadership and your passion to keep our county a great place to work and live. Thank you, and our best wishes for your next chapter. For Supervisor Gaspar, you have been a true champion for the family-owned businesses when you first served on the Ensenada City Council, and since the first day you came in to this board. Our members are so grateful for your hard work and passion to fight for what you believe in. I am certain that it will continue fighting because you are yourself a family-owned business. Our best wishes to you as you write the many chapters that yet to be written. Thank you. Now, the final comment is about this licensed tobacco ordinance. I appreciate the changes that the board have made. I just wish if Supervisor Fletcher would have entertained the suggestion made by Supervisor Desmond about reducing that timeline from 5 years to 3 years. Again, the city of El Cajon, their timeline is only 6 months, and the Department of ABC for the last 4 decades uses only 3 strikes for you to be completely revocated, your license. So I'm not sure if this is something can be contemplated because I know the technical aspect of it of this becomes again a reading 1 and 2, but I just wish that would have happened. These might seem a minor changes, but affects the livelihood of every family-owned businesses in the county. Again, congratulations for Supervisor Cox and Supervisor Jacob, and thank you for Supervisor Gaspar. I am grateful for you to give me this opportunity to speak. Thank you.
Thank you. Our next caller is 8664. 8664. And if we don't hear from you and we call your number, we will come back to you before the item ends. Our next caller is 4861. 4861.
Good afternoon, Chairman Cox and supervisors and staff. My name is Linda Barber, and I'm the American Cancer Society Cancer Action Network Government Relations Director, and I'm also the co-chair of the San Diego County Tobacco Control Coalition. I'm also a resident of District 2, and I want to personally thank my supervisor, Dianne Jacob, for your dedicated public service and leadership on this issue. If you have free time in retirement, we'd love to have you join our coalition. We had hoped that this item to license tobacco retail would pass on consent today, but since it's off consent, I wanted to take this opportunity to personally thank the supervisors on behalf of our coalition. We're happy to see these policies passed. A strong TRL has long been our goal. I want to thank Supervisor Jacob and Supervisor Fletcher for your leadership on the issue, and to Supervisor Cox and Supervisor Desmond for your yes votes last month. Supervisor Cox, thank you for your years of public service. I hope that you and Supervisor Jacob enjoy well-earned retirement. And we look forward to working with the next board to strengthen the tobacco policies that will help make San Diego County the healthy county we all deserve and want under the Live Well principles. You heard that opponents want to present amendments that will allow the tobacco industry tactics, asking for delays of implementation or reducing penalties, reducing the time frame that will count towards these penalties. None of these are helpful to address the real problem that your policy addresses and could put profit over people. Our coalition wants and needs retailers to be vigilant partners, and these policies as written will enable that. Studies show that these policies work and they reduce illegal sales, and no retailer that's vigilant should be worried about the loss of their business. Please stay the course and pass this amendment. Your communities and our coalition, thank you.
Thank you. Our next caller is 1263. 1263.
Good afternoon, Supervisors. My name is Lori Bremner, and I'm with PAVE, California. PAVE is Parents Against Vaping E-Cigarettes. We're a national parents organization founded in 2018 as a grassroots response to the youth vaping epidemic. I'm also a parent. I'm a daughter who lost her dad too young to tobacco-related illness, and I'm a cancer survivor. PAVE is grateful to the San Diego County Supervisors for your focus on this urgent piece of legislation. Youth who vape are 5 to 7 times more likely to develop COVID than those who do not vape. Lung health is an important factor in the outcome for people who are infected by the novel coronavirus. Flavored tobacco is now, more than ever, a deadly hook. The youth of San Diego County simply cannot wait for the state or the federal government to take action to protect them. Parents and kids are counting on you, their local elected officials, to step in and halt the epidemic of youth tobacco use. The tobacco industry has now submitted the signatures necessary to delay implementation of a statewide flavor ban for 2 years. The federal government has missed opportunity after opportunity to step in, and we don't seem any closer to meaningful federal legislation than we have in the past. So thank you, Supervisors, for taking decisive action today for the kids of San Diego. We at PAVE are in support of the rapid implementation of a comprehensive tobacco retail licensing ordinance that includes an annual fee and includes a full ban on the sale of all flavored tobacco products, including menthol cigarettes. The need is urgent. Thank you.
Thank you. Our next caller is 8754. 8754.
Hi, good afternoon, Chair Cox and Supervisors and staff. My name is Chelsea Walczak-Burks, and I'm the Senior Community Impact Director for the San Diego American Heart Association. I'm also a resident of the city of San Diego. And I want to thank the board, specifically Supervisor Jacob and Fletcher, for their leadership in working to address the youth tobacco and vaping epidemic. Easy access to candy-flavored tobacco is fueling the sky-high numbers of youth tobacco use we're seeing today. And now over 30% of high school students use tobacco. In recognition of this alarming trend, the American Heart Association supports ending the sale of all flavored tobacco products and licensing tobacco retailers with strong enforcement. These policies are critical to stemming today's youth tobacco epidemic by reducing tobacco access, initiation, and use among kids. The county recently released findings from their June 2020 youth tobacco purchase survey, which found that nearly 20% of the 161 retailers surveyed illegally sold tobacco products to our kids. Among smoke and vape shops, over 28% sold to minors. And among independent stores, 1 in 3 sold to minors. This data underscores the need for bold action to protect San Diego County kids from a lifetime of nicotine addiction and tobacco-related disease and death. We cannot wait any longer for these measures to be implemented. Please put the health of our kids first and adopt the measures before you today. Thank you so much and appreciate your leadership.
Thank you. Our next caller is 3274. 3274. And again, if we don't hear from you when your phone number is called, we will return to you during public testimony on this. Oh, hello.
Hello. Oh, so sorry about that. Good morning, Mr. Chairman, members of the Board of Supervisors, and county staff. My name is James Allison, and I am calling with the California Fuels and Convenience Alliance on behalf of San Diego's fuels and convenience retailers. We are asking that the county consider the current crisis facing small businesses across the nation, especially now in San Diego. The new rounds of shutdowns have presented a revived challenge that simply cannot be overcome. Revenues, even for many essential businesses, have been slashed as a result of the pandemic. Many of the members are reporting as much as 60% declines in sales as direct results of the pandemic. As of yet, prospects of any recovery are bleak at best. In localities that have already implemented bans such as this, revenues for stores can be cut by as much as 40%. These are not large corporations that can bear the brunt of this loss. Many, despite the logo above their door, are small, single business owners and franchisees. Contrary to what many may believe, these small businesses are people, and their families depend on their stores for their survival. These potential cuts at what is arguably the most severe time for this pandemic could very well be the final nail in the coffin for many of these businesses. Today, we are simply asking that you delay the enactment of this ordinance until after these small businesses have begun to recover from this ongoing crisis. A number of localities have already delayed implementation of these ordinances or have granted hardship exemptions to businesses currently reeling from this emergency. We ask that San Diego County follow this trend and offer the same opportunity to the hundreds of small businesses that will face the repercussions of this ruling. While we understand at this time that the effort and time that the board and staff have put into this ordinance has been long and grueling, we respectfully ask that you delay the implementation of this ordinance. These businesses today depend on your leadership, and we thank you for your understanding. Thank you.
Thank you. Our next caller is 0530. 0530.
Hello.
Hello.
Can you hear me?
Yes, we can hear you.
My name is Ahmed Abdelkader. I am a resident and a tobacco business owner. I want to thank the county for what you got to at this point with the TRLs and everything. Just bear in mind, we are small businesses trying to survive, trying to pay rent, trying to send our kids to school, pay our health insurance too. We are people too. We happen to sell tobacco, which is legal. We abide by the rules. We check the IDs. We are people too. Think about us. Thank you.
Thank you. Our next caller is 7978. 7978.
Good afternoon, Chairman Cox and Board of Supervisors. My name is Rima Corey. I'm General Counsel for FMARI, and I'm also a founding member of the National Hookah Community Association and resident of District 5. We want to thank you for your leadership in implementing a TRL in San Diego County while also recognizing the centuries-old cultural tradition of hookah, and by also allowing minority small business owners to pass their businesses and TRL license to family members. We support your efforts to address youth usage and access, and the National Hookah Community Association intends to develop a strong relationship with San Diego County and San Diego to implement best practices, because we also believe that it's very important to keep our youth away from tobacco products. I also wanted to thank Supervisor Cox, Jacobs, and Gaspar for your many years of dedication and service to our community, and for listening to your constituents and putting in so much effort to make us a better place to live. Thank you very much.
Thank you. And Rima, did you have another person who wished to speak who is also calling from your line, because we're seeing your phone number twice on the Zoom meeting?
Yes.
Okay. We'll go to the other caller from the same line next. If that person can please state their name for the record too. Thank you.
Okay, thank you.
So the other person from 7978, you'll need to press *6 to unmute yourself as well. The other caller on 7978 needs to press *6 at this time if you'd like to address the board. If not, we will go on to 8198. 8198. If either 8198 or 7978 would like to address the board on item number 8, this is your opportunity to do so. It's the last call. You're the last two callers on the line for this item. Or 8664.
Good afternoon. Can you hear me?
Yes. Hello.
Yes. Good afternoon. My name is Jaime Rojas, and good afternoon, Mr. Chairman and board members. I'm with the National Association of Tobacco Outlets. I want to first give thanks to Supervisors Desmond, Cox, and Gaspar for listening to the business community as well. We are in full support of a tobacco retail license and have seen it through the past decade be successful through various communities in California. We also understand that this issue started as a vape issue and somehow converted with misinformation about all flavored tobacco products. Unlike many of the speakers before me who gave misinformation in regards to success rates, lack of success rates, the FDA and state have had San Diego County retailers at a 95% success rate in compliance for the past 5 years. We want to continue working with the county, continue working with tobacco control in a program that actually works. The cities of San Francisco, Oakland, San Mateo County have seen no numbers drop in regards to a full flavor ban. And we all know, including the state of California's health department, that the issue is online sales and not responsible local tobacco retailers. We thank you for the support on the modifications, and we wish the best of luck to the supervisors. Thank you.
Thank you. 8198. 8198. If you'd like to speak, please press *6 now to unmute yourself.
Hello. Thank you, supervisors, for the opportunity to speak. My name is Mayra Bautista. We spent all morning hearing about the impact this global pandemic has had and the effect it has had on everyone in the world. Not to forget the hardship that we all agree has happened in the voices we heard this morning from our small business San Diego community. I am a mother, a daughter, a sister, a caregiver, a small business owner, but most of all, I'm a veteran, and I've spent the last 30 years protecting my rights and rights of others and my fellow Americans. I am an immigrant and an immigrant daughter. My father did not speak the language, nor was he an alumni, and we cannot depend on our economic growth from many of our predecessors. We came here with no opportunities. So he created his own opportunity by starting a small business. Today, I continue to advocate for small business. That is what I do. I think that advocating for those opportunities make me think of all the opportunities they had and the impact it had on my family. As a non-tobacco user and as a mother of two, I agree that no one under 21 should be using tobacco products, especially our youth. However, what I've seen is that our mutual goal is to create safety and to have products that are FDA approved. I can give you endless data that smoking is declining every year, year after year. However, most of the vaping issues that we saw early were because of the devices being tampered. One of the problems that I see is that without it being regulated or FDA safety, it allows for drug dealers and black market to tamper with this product. We can focus on working together. What I propose is that we continue with the state's recommendation, putting everything right now on hold. We've had over 1 million signatures to say, let's look into this before we just ban this product and not have any solutions. I think we need to work together, postpone this, make sure we're not hurting our small businesses, especially right now that they are they're legally selling tobacco just as they do alcohol. I know that I mentioned that I'm not a tobacco user, but I do drink wine. And I'm sure there would be a big problem if we couldn't have Plum Jack's winery be able to serve serve customers a legal right that we have as 21 and older. So I urge the board to please consider putting all this on hold. Let's not hurt the small business and let's focus on a solution, because we don't want drug dealers to come in and be able to do things that we can't have rights and FDA approved. Thank you.
Thank you. And this is the final call for 7978. 7978, please press *6 now if you'd like to address the board. And if not, then that concludes public testimony on this item. Chairman Cox.
Thank you very much. We'll move on to board discussion. Supervisor Fletcher.
Make a motion to approve. We've debated, discussed, amended, changed.
Second.
Okay, we have a motion and a second to approve the recommendations on item number 8. Any further discussion? Hearing none, I'll ask the clerk to please call the roll.
Thank you. Chairman Cox?
Aye.
Supervisor Jacob?
Aye.
Supervisor Gaspar?
No.
Supervisor Fletcher?
Fletcher, aye.
Vice Chairman Desmond?
Yes.
Chairman Cox, that motion passes with Supervisor Gaspar voting no, all other supervisors being present and voting aye.
Okay, the next item on our agenda is item number 14. This is the first quarter status report, and I believe Helen Robbins-Myers may have a few introductory comments, and then Ebony Shelton will give us the report.
Thank you, Mr. Chairman. Yes, I'm just going to turn it directly over to Ebony, and because we're late in the hour. So go ahead, Ebony.
Thank you. Chairman Cox, members of the board, as a part of the first quarter operational plan status report, I'd like to also share an economic update. I'll begin with a look at indicators of current economic conditions, then move to the county's budget performance, including an update on how the books closed last fiscal year. I'll conclude with a look ahead into the coming fiscal year. So let's begin. I'm starting this presentation with a discussion on the state of California's outlook because in many ways, it's indicative of what we have and are experiencing here locally. In the spring, the economy abruptly ground to a halt. Millions lost their jobs, businesses closed, and consumer spending dropped. Almost as quickly, individuals began to adjust, which coupled with federal economic stimulus led to a quick rebound over the summer. While the spike in unemployment was historic, it was less than feared, and now at levels comparable to the Great Recession. And like the county, tax collections at the state level have been better than anticipated as high-income earners with stable employment have been able to maintain their obligations. In building the budget, the state legislature took actions to address a sudden and unknown budget impact. However, based on information available now, the budget problem this year will likely be lower than originally estimated. As a result, the state is anticipated by the Legislative Analyst's Office to generate a one-time windfall of $26 billion to allocate in the upcoming budget cycle, but structurally the budget still faces gaps ahead in 21-22. These trends and general outlook are consistent with what we are experiencing here locally, and you'll hear similar themes today. Let's start with a closer look at unemployment. Unemployment levels spiked, reaching highs in May. Since then, employment levels have started a recovery, but it's clear based on the latest unemployment numbers from October that labor markets have not yet fully recovered. Next, we'll take a macro view of our local economy. This slide is an overview of indicators of local economic impacts with results consistent with those previously reported to your board. 80% of the region's unemployment is concentrated in the tourism, retail, and education sectors. This, combined with decreases in foot traffic to local attractions and air travel, have contributed to decreases in consumer spending. However, this indicator has demonstrated some recovery with spending on hotels and restaurants down nearly 37%. And for the calendar year, San Diego's gross regional product, which measures the value of goods and services produced within our region, is down 4 to 6% compared to 5% during the Great Recession. Next, let's take a look at the local real estate market through assessed property values. This slide shows results and projections by our local assessor, Recorder County Clerk, of assessed property values, which drives the largest component of general purpose revenue in the form of property taxes. When we built this year's budget, we assumed assessed value growth of 3.75%. However, results were slightly north of 5%. The better than expected growth will help to partially offset a decrease in the growth level that's expected for next year's budget. The original assumption for next year's budget, fiscal year 21-22, was 3%, but has been adjusted downward to 1%. Although the residential market remains strong, business restrictions are expected to result in proactive temporary reductions of property values and a lower than usual inflation adjustment. We'll continue to work closely with the assessor to refine revenue projections as we prepare for next year's budget. Next, we'll turn to the county's retirement fund. The county's worked with SD Sarah's actuary to prepare an interim set of projections pending the release of SD Sarah's valuation next week. While the fund did not meet its earnings target, it did earn 1.1%, compared to the 7% loss that was originally anticipated. These results will begin to impact contribution levels in the next year budget cycle, smoothed in over a 5-year period. A few of the key metrics that we compare year to year are the unfunded liability, which is anticipated to be relatively flat, the funded ratio, which reports the percentage of the retirement fund's assets compared to its liability, which is expected to show a slight improvement, and employer contribution rates, which are expected to grow to roughly 46%. Next, we'll take a closer look at what this means in terms of county contributions. Here we see historical cost and projections for the county's total pension cost, including pension obligation bonds. As I mentioned, SD Sarah's 2020 evaluation will impact the county's total cost of pension next year, with total cost estimated at $737 million. This chart shows that the county's total costs will peak at $947 million by fiscal year 25-26. Important to note is that the projected amounts are based on the retirement fund meeting its assumed rate of return this year and annually. SD Sarah's current assumed rate of return is 7%. The cost presented on this slide reflects stability in that rate through fiscal year 22-23, but also include the impact of reductions in the assumed rate of return down to 6 3/4 starting in fiscal year 23-24, then down to 6.5% for fiscal year 26-27 and over the following years. While the average investment return for the last 10 years was 7.6%, more recently, average returns for the last 5 years were 5.3%. Therefore, we believe it's prudent to plan for further reductions. With that as background, let's move more on to talk about our financial position. And we'll begin by reviewing the county's first quarter budget status report. Overall, the county's projecting positive results from budget for all funds of $236 million. All business groups are expected to end the year with positive balances except for the Health and Human Services Agency due to the inclusion of future COVID-19 emergency response costs not eligible for CARES Act reimbursement. The $166 million positive variance in the general fund is mostly due to unanticipated one-time general purpose revenues, which include better than expected assessed value growth, improvements in property tax collections and penalties, and former redevelopment revenues. In the public safety groups, results are being driven by vacancies and attrition in the Sheriff's Department, as well as over-realized revenues from the trial courts for security. Expected results in public safety also include higher trial court fines and traffic school fees. Projections in finance other include amounts appropriated to begin the replenishment of the general fund's minimum reserve target. The remaining balance outside of the general fund is largely in the Public Safety Proposition 172 Special Revenue Fund, resulting from improved sales tax revenues. These operating results will be leveraged in the development of the upcoming budget cycle. The action before your board today includes recommendations to increase the total budget by $23.1 million, including an increase of $18.7 million in the general fund, which includes appropriations of unassigned general fund balance totaling $3.2 million, and will provide authority to make other adjustments that do not increase the overall budget. Next, I'd like to share the financial results as reported in our recently completed Comprehensive Annual Financial Report, or our CAFR, for the fiscal year that ended on June 30th. This slide compares the 2020 CAFR results to the prior year with a focus on near-term resources within the general fund in 5 descending categories, which reflects availability of those funds. Non-spendable includes items that can't be spent, such as inventory and receivables. Restricted balances with external legal constraints, such as federal pass-through loans for housing programs or public safety realignment. Committed amounts obligated by the board for various purposes, including amounts for capital projects and social services programs. Assigned balances include amounts appropriated for one-time expenses in this year's budget, for multi-year contracts, and funds set aside for redevelopment. And this leaves unassigned balances for economic uncertainty and risk mitigation, which decreased by approximately $4.3 million. This is an improvement from the sizable decline that was anticipated at the time of budget adoption, and is in large part due to better than expected property tax revenue collections, but also more favorable year-end results and the net effect of various adjustments made in the CAFR. The minimum general fund unassigned reserve target increased from $646 million to $718 million. And with this as background, we'll next review the anticipated levels of unassigned balances. This slide is the preliminary projection of the general fund unassigned fund balance. To understand where we might be when we close the books this year, we have to take into account all of the pluses and minuses that are expected to occur between now and then. These figures on this slide will change, but provide an indication for planning purposes. Beginning with the unassigned amount from the 2020 CAFR of about $708 million, we add this year's general fund operating results that are projected, as well as amounts for a known balance sheet adjustment associated with redevelopment dissolution. Next, we subtract the recent uses, including the support of the region through the additional allocation of $20 million for the Small Business Stimulus Grant Program, amounts recommended for approval today, and replenishment of the minimum reserve target. And finally, we subtract any amounts that are planned to be programmed into next year's budget, which at the time of budget development were estimated to be $139 million, but will be refined through the planning process as we prepare for next year's budget. I'll close the presentation with a look ahead. The county's projected spending includes continued response activities. We anticipate that the arrival of a vaccine will bring some benefits, but that timing and its influence on the economy are still very much unknown. Questions about the likelihood and timing of additional federal economic stimulus still remain. And although the state is projecting a one-time surplus this year, the projected operating deficit and corresponding decisions that it will make to bring its budget into balance will likely impact county finances. A new year will also bring about exciting changes for our region as leadership of our Board of Supervisors brings with it changing perspectives and evolving priorities to engage the passion and creativity of the county workforce. And looking ahead, the county's leadership team is preparing for ongoing conversations with the new board and community about county resources and spending, with an understanding, of course, that we're not immune from economic realities and that there's much uncertainty ahead. In response to that uncertainty, earlier this year, your board ratified the CAO's action to suspend certain financial provisions of the administrative code. The effect of this action include allowing unassigned fund balance to be drawn below the minimum target, and suspending requirements to use debt savings and certain unanticipated revenues to cash fund capital or send voluntary contributions to SD-SARA. These actions remain in effect and are necessary to provide financial flexibility as a part of the county's financial first aid toolkit. As we look ahead, the county continues to craft budget solutions to fit the current environment through the implementation of austerity measures while simultaneously positioning the organization to direct available new resources to meet existing and new priorities. I look forward to providing continued updates to the board and the community in the coming months, and this concludes my presentation to you today. Thank you.
Thank you, Ebony. Are there any questions of Ebony or Helen?
Yes, Mr. Chairman. Ebony, great job. Really a good presentation. I'd like to zero back in on the retirement fund assumed rate of return and the likelihood of that being reduced into the future, maybe I missed it, but if the rate of return right now is 7%, expected rate of return, if that's lowered by 1/4 down to 6.75, how much does that 1/4% represent in dollars?
For that particular drop in the assumed rate of return, Supervisor, it's anticipated that it would be approximately $50 million. As each drop in corresponding goes on in time, it actually has a slightly larger impact. So for example, the 6.5% drop will be slightly larger in terms of impact in totality. But that particular drop is expected to be approximately $50 million.
Thank you. And that's going to depend on the SD-SARA board and the actuarial. But with the rate of return, as we're seeing it, exception this year, we don't know yet, it's very likely, at least it's going to go down 1/4%. We just don't know when that's going to take place. But I think that's important for Supervisors Fletcher and Desmond to keep in mind going forward, that from what I see in your budgeting, you have not projected what would happen if there was an additional $50 million impact on the budget. Is that correct?
That is correct. We have it certainly planned in terms of timing, assuming that it will occur in fiscal year 23-24. But if there was to be something that happened outside of that cycle, that would certainly be outside of our planning.
Okay, I just wanted to emphasize that going forward, that's something to keep an eye on. And if it's down 0.5%, you're talking over $100 million. So for budget planning purposes into the future next year and the years after that, really important to focus on that because the earnings have not met the expected rate of return the last couple of years. So anyway. With that, I think there's an action to be taken here, and if it's okay with the chair, I would move the CAO's recommendation.
Okay, I'll be happy to second that motion. Is there any discussion on the part of our board colleagues?
I just have a question, Mr. Chair.
Go ahead.
Ebony, on the unassigned reserves, I think you had them at like 738 million. Is that by the end of this fiscal year that you're assuming we're going to be able to get? I mean, it looks like where we need to be. So are you saying we're able to recoup or put back all of the reserves that we used for COVID thus far?
Supervisor Desmond, at this point, we're referring to the projected unassigned balance at the end of fiscal year. The current fiscal year 2021, excuse me. Yes, we are anticipating that we would have replenished ourselves back to the minimum target that was established for the end of the current cycle. So that minimum is $717 million. We don't know what the minimum will be when we close the books at the end of this current fiscal year. And again, the amount that we're projecting, if we can go to the next slide, please.
Next slide.
Of $736 million for the end of the current fiscal year is just a projection. One of the big assumptions that's here is that we have a planned uses in fiscal year 21-22, next year's budget cycle of $139 million roughly. And that's a big assumption. There's still a lot of uncertainty going on in terms of recovery of certain revenues and what will be required in order to address structural issues that we have going forward. So we're actively involved in discussions on that point. This is just an illustration of what that might look like.
Okay, and I'm sorry, my question, I was talking about reserves. I'm just looking at the fund balances here, and I appreciate that. All right, well, we'll keep an eye on it. Thanks for the clarification.
Absolutely.
Any other comments? Okay, we do have a motion by Supervisor Jacob, seconded by myself. If there's no further comment, I'll ask the clerk to please call the roll.
Thank you. Chairman Cox?
Aye.
Supervisor Jacob?
Aye.
Supervisor Gaspar?
Aye.
Supervisor Fletcher?
That's right.
Vice Chairman Desmond?
Aye.
Chairman Cox, that motion passes unanimously with all board members being present and voting aye.
Thank you. The last action item we have on today's agenda is a resolution renaming the Santa Isabel Nature Center in the Bonita Civic Complex. And this item was brought forward by Supervisor Nathan Fletcher.
Thank you. The fitting tribute for our last item of the day to be a recognition and long-lasting testament to the dedication of the County of San Diego by Supervisors Cox and Jacob. Brought forward this board letter to rename facilities in their respective districts to truly honor for all time the contribution that they've made. Together, these two supervisors have combined for more than 5 decades of service to our county. Renaming the San Isabel Nature Center to the Dianne Jacob Nature Center at San Isabel Preserve, and rename the Bonita Civic Complex to the Greg Cox Civic Complex, I think is a nice and lasting tribute to the tremendous legacy that each of you have brought forward. It's been my privilege to serve with both of you, and we certainly wish you all the best in the future. And with that, I'd make a motion to approve agenda item 13.
Second.
Okay, we have a motion and a second. My understanding is we do have some speakers. Is that correct?
Mr. Chairman, that's correct. We have 2 individuals that requested to speak in favor of this item. One of them has called in at this time, and we'll call that first caller.
Okay.
Yes, if 6511 would like to speak, please press *6 to unmute your phone now. 6511, you may press *6 to unmute yourself. Or 2524 has also joined the call. So if 2524 would like to speak, you can press *6 to unmute yourself now.
Hello.
Hello.
Hi, this is Wendy Wilson, Director of the Bonita Historical Society and Bonita Museum and Cultural Center. I just want to say we're really excited about the resolution and renaming the County Library Museum Complex in Bonita after Supervisor Cox. It will be a really wonderful legacy, really exemplifying the supervisor's dedication to community education, history, the arts and culture of South Bay.
That was good that she was on first.
Thank you very much. Were you all finished with your comments? If so, then would 6511 also like to speak? 6511. Need to press *6 to unmute yourself.
Okay. So, Greg, as you know, the Bonita Museum is so very appreciative for all you and the Board of Supervisors has done for us and Bonita all these many, many years. Without you, we would not be where we are today. Scott would be here, but he's down at the museum supervising the mason who is building the base for the horse. So you'll need to check that out. And you always need to remember that we're looking for volunteers. And if you get bored, please come to the museum. We'll put you to work. Thanks.
Thank you. And could you please state your name for the record?
Barbara Scott.
Thank you very much. I'm just confirming that 2524 was all finished with, Wendy Wilson was finished with her comments as well?
Yes, thank you.
Thank you. Thank you again for calling in. And that concludes the public testimony on this item.
Okay, well, we have a motion from Supervisor Fletcher, seconded by Supervisor Gaspar. Let me just say, Supervisor Fletcher, I'm humbled by your suggested action. Very appreciative of Wendy Wilson and Barbara Scott and their comments. you know, we've had a lot of accolades today, but having something named after you while you're still alive is really something very special. So I just want to say thank you very much for your gesture. And again, I thank all the people in Bonita and folks at the Bonita Museum and Historical Center have just been a real source of pride to me and what they keep giving back to the community. So thank you very much. Supervisor Jacob?
Mr. Chairman, I would add to that, again, thank you, Supervisor Fletcher. I thought that you only name things after people when they are dead. So I'm hoping that the action, if it passes today, it's not a self-fulfilling prophecy. Greg and I both want to be around for a while.
It is not, Supervisor Jacob, it is not the Dianne Jacob Memorial Preserve. It is not the Supervisor Greg Cox Memorial Preserve. And I don't think we should wait until people are gone to let them know how much we appreciate them. And so I think it's something that we want to do now, and we want you and your family and your staff and supporters to be a part of this unveiling and the recognition and have a chance to enjoy it. So
thank you.
You're very welcome.
Any further comments from our board colleagues? Hearing none, would the clerk please call the roll?
Thank you. Chairman Cox?
Aye.
Supervisor Jacob?
Aye, as long as it's not a conflict of interest.
Supervisor Gaspar?
Aye.
Supervisor Fletcher?
Fletcher, aye.
Vice Chairman Desmond?
Aye.
Chairman Cox, that motion passes unanimously with all board members being present and voting aye.
Well, it's hard to believe, but we've actually completed all of the action items on our agenda for today. We do have 5 items to consider in closed session. We will proceed into closed session immediately after the adjournment of this meeting. And then we will be reconvening tomorrow morning at 9 a.m. If there are any items to be reported out from closed session, that'll be dealt with tomorrow morning at the beginning of our land use hearing. Is there anything else we need to cover today?
No, Mr. Chairman.
Okay, if not, we will stand adjourned until 9 a.m. tomorrow morning.